Okay, everyone, I'm joined here with Vonnie McWilliams, and Vonnie McWilliams is the Dial Centre Manager at the Northwest Regional College, and she's also a specialist occupational therapist. So thanks very much, Vonnie, for joining us here in the R&D Healthcare Innovation module on the Postgraduate Diploma in Digital Healthcare. So the whole idea of our just our meeting or our session here today is essentially to get an idea around your experience of healthcare innovation within your role at Dial, but also within your occupational therapy role. And it's just to get that experience and give it to the students in terms of what your thoughts are around emerging technologies, but also enabling technologies in your own context, because they're going to have to come up with a project idea to explore themselves, and that idea generation is often the most difficult part of research. So I'm going to pass it over to you now, Vonnie, and if you just want to give me an introduction to both yourself and then to the Dial Centre.
Okay, well, Kevin, thanks a million for the invite. Really appreciate it. And the course sounds amazing. So great and ahead of the game, so well done. Hi, everybody. I'm Vonnie McWilliams, and we're here at Dial, which is a design, innovation and assisted living centre. And it's based here in Derry, Londonderry in NWRC. We're an innovation centre that test beds new products and designs. And I'm Vonnie McWilliams. As Kevin said, I'm a specialist occupational therapist that's worked across neuro, learning disability, dementia, and mental health. So we've got a nice round background of different areas. So as an occupational therapist, bit like yourselves, you know, we get into the profession because we love what we're doing and we want to help people. So as an OT, I really value maximising the individual's potential, whether that's physical, mental health, social, or in their environment. So it links in well that the manager of Dial is a OT background, because we look at the holistic area of how someone is affected in their life. So here at Dial, as a health and wellbeing innovation centre that supports entrepreneurs, possibly like yourself, industry and the community as a whole, we look at new technologies, emerging technologies that have been in existence for years to new developments, especially around e-health, and probably what yourself and Kevin are exploring. So in Dial, we assist early stage entrepreneurs, micro and SMEs, idea generation, prototype development, and we look at user client groups, which is a big plus for Dial. So we can use a test bed of feedback, quick feedback. Is that product working? Why not? What do you need? Are the colors right? Is it fine finger movement? So it's quite a dynamic position, which I love and I'm thankful for. So that's a wee bit about me and Dial.
Okay, thanks very much, Bonnie. So within the Dial Centre, and I think the Dial Centre in itself is a very innovative idea, and this whole idea of having somewhere to demonstrate technology, having a test bed where, you know, I know you're working with carers, family carers. There's a load of stakeholders with varying disabilities or you know, health problems where they need enabling solutions that have come in and had access to the centre already. But it's also a great centre for yourselves in Northwest Regional College to have your own students in and being able to see what's available to them. I think it's an amazing idea, and I haven't had the opportunity of going in and actually exploring the centre. Some of the ideas in there are amazing, and you know, it's the kind of ideas that most of them that are there would have real legs in terms of being able to work on the private market, as well as, you know, being something that the healthcare system should be investing in terms of enabling families and enabling patients to live well at home. And this whole idea of living well at home is something that we've discussed many times before. So like I kind of want them to have a feel, the students here, I want them to have a feel of the types of solutions that you're currently demonstrating within Dial. If you would just give me a few examples of the types of solutions that have worked well in terms of whenever you've been demonstrating, that have got positive feedback essentially from people. And, you know, these obviously range from the simple solutions, you know, the everyday enabling, but also the life-changing solutions. And if you give me a few examples of that, that would be great, Fonny.
Yeah, okay. I suppose, Kevin, because you've been in, the building is designed on best standards for dementia. So embedded in Dial, you've got what's called biodynamic lighting. So there's lots of research around biodynamic lighting, and it's basically to go with your circadian rhythm. So the more daylight that you have, circadian is your awake asleep cycle. So in dementia, that turns around, you know, so that you're asleep during the day and awake at night. But like a lot of conditions, even with this coronavirus, when we find ourselves working from home, eating from home, pleasure was at home. Every role we had was in one environment, and you know, you might turn the big light on and it might be on all day, you know, during the winter. So you're kind of like, I'm not ready for bed yet. So biodynamic lighting is about getting as much natural daylight in as possible to help your circadian rhythm. So here in Dial, we've got lots of windows on the roof that work with different switches. So if you were a wheelchair user, there's 12 windows, but you could just press one button and it closes them all if you want that, or closes them individually. So for me, that embedded environmental solution is massive, and it's subtle. So usually people walk in and go, wow, I'm loving the light in here, it seems so airy or something. And then you explain actually that it's about the circadian rhythm, and they're like, oh, okay. So that would be one of my faves. Another one, a small solution, would be doing a lot of work with the RNIB and Geraldine here in Derry, Londonderry. Small solutions that you can get off the shelf are also good. They don't have, they can involve tech. So a bit like what you're thinking, what tech, what e-health, what computing, but they don't have to be expensive. So like this is called a liquid indicator. And I don't know if you can see, there's those wee prongs, there's 3 wee prongs. So this sits on the edge of your cup and then beeps when you come to this long one. So that's for your coffee or your tea. And then there's a shorter one where you can add your milk. Now that is £2.75 and you can get that from RNIB. And you might think, sure, what's that? It is a lifesaver. It saves people from getting scalded when they're pouring in from the kettle. And it means that they're not waiting on a carer or a loved one come in and making them a cup of tea. They've got independence, dignity. They're using their own time in their day. It's massive change.
That's brilliant there. Just in terms of like helping people live independently, something like that there can seem like such a small innovation, but it can have such an impact on somebody's life. Because if, you know, for every time you wanted a cup of tea, you had to go then and ask somebody. If you live alone, then, you know, you're waiting for somebody to come round to be able to do that for you. So you're feeling very dependent on somebody else.
Yeah.
And that can have, psychologically, that can have a severe impact on you, you know, where you feel like you're always putting somebody out, and you would love to do that yourself, but there's risks associated with it. For a few pound to be able to have a solution like that is amazing. Like, I would go as far as saying that would be life-changing.
Yeah, no, I'd agree with you, Kevin. And I mean, what you can do and how we would help entrepreneurs is then, do you want to put any software in there? How many times do they make a cup of tea? You know, how long is this in the cup before they take it out? Is there a change in their ability to make a cup of tea? And you can record that information. So it might be about taking something really simple and then adding a bit of software to it and making it more kind of predictive and long ranging into the future.
Thanks, Vonnie. So I want to go back to your role as an occupational therapist. So your background is in occupational therapy, and you do have a track record of removing barriers and enabling people to regain that independence that we're talking about. Can you provide a recent example from your own practice of enabling solutions that you've developed with your clients?
Yes. That is a good question because there's so many, and as you say, it depends on what client you're working with, what conditions they have, and what they see as their obstacles are. Because you might know as a clinician the progression of a condition, but that person might not be psychologically ready to make those adaptations, you know, or adoption of technology because they're just not psychologically ready to take it. So when someone is, or you gently show them what's available and what it would mean to increase their independence and enable them to have a more healthy and well-being life, it's great. So I'm thinking of one recent client that I worked with who has a mild learning disability but has cerebral palsy. And they are moving into a new house. So what I've done as an OT is link up with the speech and language therapist and they've got an iPad that they were just using it for Facebook and everything for. So because they're used to that technology, she's in her early 20s. We're taking that iPad and what we're doing is putting an app on top of it, which is a communication app. It's a couple of £100. Used to be a couple of thousand. And that's the joy about technology. You know, it can start off crazy price and then come down as more people adapt it. So with this app, she, looking at her cognition and her processing skills and her fine finger movement, we can figure out how many questions or answers we want to put on each page. So she could do 24 a page. Some people can do 3, you know. So her cognition's pretty high. And you can have 12 pages and she can have a full-on conversation with you because she's non-verbal. So she can ask for what she wants in the shop, when she wants to go to the loo, she wants her hair done, wants her nails done, all those important things. And on the back of that, as an occupational therapist, then I'm attaching environmental controls on the same iPad. Yeah. So because she's a wheelchair user, she can now open the doors just with the press of a button or use an eye gaze, but the press of the button seems to work better for her. So doors, windows, lights, TV, heating. So very much like that small solution, Kevin, you know, it's life-changing for someone. It's enabling them to be independent and reach their kind of maximum potential.
Yeah, and I think that that sort of idea where you're sort of saying that works well for her. So in terms of like your client is king there, where essentially you're trying everything to suit them because essentially you are enabling their life. So every client's going to be different. There's going to be a lot of solutions that work well for some that don't work well for others. And for you as an experienced occupational therapist, that's something that you find, you know, I wouldn't say easy, but you know, it's something that you've been able to craft over the years, that you know, you've come up with a load of different options. You have a massive toolkit there that you're able to select from. So in terms of individual clients with individual needs, you have an idea in your head at the start as to what you could try, and then you're refining those solutions. You're having a look at their cognitive ability and their motor skills and all the sort of variables that go into that to help you refine what solutions would work for that client. And I see that very much as a challenge. So somebody early in their career in occupational therapy, I would see that as a challenge where you're coming straight out of university and you're going in and you're starting practice. You don't have that toolkit. University prepares you only so much. There's a lot of real world that you don't know at that point. And I see that very much as a challenge. Do you think that technology can help resolve that in some way? And that toolkit that you got, essentially, share that knowledge with other people?
Yeah, definitely. I think some of the people in your class could come up with a solution, perhaps, because you've hit the nail on the head there, Kevin. You could have me looking at various toolkits that I know just because I've been in the job for over 20 years, and connected with different people and worked across different specialisms. But if we're talking about getting the best for your client, it shouldn't rely on you having 20 years knowledge or 40 years knowledge or just a year out of university. We should be given the same thing to our clients. So if there was an app or a platform that hosted all the solutions available, and maybe which ones work together, which ones you could pair together, you are going to be the love of the NHS, because it not only saves the clinician time trying to source all that information, it also will save your service time, because they might have, over the Western or the Northern Trust, you might have 10 OTs in the same week looking for the same products, and it takes time. So the managers are going to love you because you're going to be cutting that time. And then the important person, the client, will get it quicker. And isn't that what we're all about? So, and if we know that there's a product that's 10 of us are using, then you could start looking at generating ideas and product ideas around, well, let's look at the outcomes. Is this any good? Let's do research into the app and feed back to the designer and say, this was great, but this here didn't connect. Can we meet those two up? And it's that collaboration, Kevin, that we do here at Dial, and you guys are doing, that just starts floating best practice, better innovations, because it's coming from a real life solution. It's not coming from a designer going, God, it'd be great. How could we stop people having fractured neck of femurs? Because you should see some of the solutions, because a designer has come from that point of view. They're not practical. But if you come from a clinician point of view with your knowledge and steering, Kevin, you've got a real possibility of making something amazing that will have an impact to your client, but not only that, the service and the whole healthcare.
Yeah, I think that whole idea of collaboration, and in teaching we would often use the term community of practice, and that's essentially what you want to build. And essentially, whenever you're going to training sessions, you're meeting up with other OTs. That's what you have. You have that community of practice where you're sharing experience about specific products, specific solutions. But essentially, it's not being managed in a central way. It's all very much you putting yourself out there, you taking the time to keep up with your own professional development. And, as a result, there is an inequity there in what's being provided from one client to another, depending on the experience of their occupational therapist. And there's a whole area of technology around this, open sourced and crowd-funded. So essentially, where, I'm a technology person, so I know nothing about occupational therapy. I'm going to create a platform. So if I create a platform, I'm creating an empty shell where essentially I would want the community to build that up for the sake of the community. So, you know, I'll have all the different conditions, the medical conditions. I'll be putting in some examples of solutions there, but it would have to be something that would be, you know, updated by multiple people. So essentially you have these Web 3.0 and Web 4.0 frameworks where people can add their own products, they can add their own reviews of those products, so products that they use within their own practice or solutions that they've put together within their own practice. They're reviewing and the community is deciding. So the more people that rate these, the community is deciding what works well for each of those conditions, and then essentially you've got that toolkit built up. Now it would take years to get to that point where you're essentially sharing all this knowledge, but then it's there, and it would make your life so much easier if you were starting out. Probably not those with experience, because you have a lot of that, but essentially, you know, there's things you do forget. We're all human at the end of the day.
And I think, Kevin, even though you have experience, you know, we're still in our silos to a certain degree, although I'm breaking down every wall I can there, but you know, someone who's just out of university has a lot to offer, because there'll be a time where your module is in a graduate program, you know, and they'll be coming out at the forefront of all possibilities. And because software is moving so quickly and there's a real push for innovation, you know, I don't know if it'll take years anymore. You know, I think if you've got the right people, as you say, in collaborating round the table, and sharing the ownership of it, you're gonna drive a beautiful product forward. And I think you can do it quite quickly, you know.
I think that shared ownership and that buy-in is probably the key there, where essentially you have to work with that community, you have to develop it based on that community, because they're the stakeholders, they're the ones that are going to be using it. It's going to be enabling them to enable other people. So because of that, you know, you need to have the community on board at the start. And you know,
sorry, Kevin, I 100% with you. I'm jumping in because I'm thinking of Elemental Software, you know, based here in Derry, Londonderry, and to me, it's a fantastic product, and it came from the community, and that is why it's a success. You know, social prescribing model where you can use outcomes. So yeah, we're totally agreed on that principle. It has to be collaboration, and it has to be from the problem, and the solution grows from the problem.
And I think that's definitely, and Elemental are a good example of that, and Leanne's hopefully going to come in and chat to the class about their platform. But it's that whole idea of, you know, starting with the people that know the problem and helping them create a solution. Like I find a lot of the times, me coming from a computing background, I see a solution and it isn't necessarily going to solve the problem. It's a technology solution that I think what the problem is, but I'm that arrogant that I won't go and check with the people actually working in that area and find out if it's an actual problem, if it's something that can be solved using this technology tool. And I think for the last maybe 10 or 15 years, that's been the way, you know, where there's been a lot of research projects that haven't solved problems and are sitting on a shelf and aren't being adopted. And if there was that collaborative piece there would be a lot less of that, you know, and there'd be a lot more demonstration of these tools in centres such as Dial, where, you know, they could have an impact on somebody's life. And it's the going away from the technology problem to this is a healthcare problem. And this was the whole idea behind this course, where, you know, they're all the students on this postgraduate diploma are healthcare students, you know, they come from a healthcare background. some of them have many years experience in healthcare, and we're providing them the computing element. And I don't think anybody's better placed to solve that problem than those that are working in the industry. So
Yes.
I definitely like that. That's testament to the course. I haven't come up with the course. I haven't been involved in the creation, so I can sing its praises. And you know, part of it may work well, and they may work with somebody else from a computing background, you know, where they haven't had exposure to different programming languages or whatever as part of their course. But that collaboration piece, you know, being that middleman between the what's possible and what's required is definitely an area that's missing in a lot of cases nowadays. And that's where I see this digital healthcare idea forming more. So thanks for that interesting conversation, Vonnie. I'm going to take a short break here, and then I'm going to have a few more questions for you after the break.
Okay, thank you.
Okay, thanks. Okay, so thanks for joining me again, Vonnie. And in this session, this short session, we're just going to ask a few more general questions, not related to Dial or your occupational therapy background. So it's just really going to concentrate on trends and technology. And the first question I have is, do you think that technology and sort of the integration of technology can help expand capacity in healthcare? Do you think that that's something that could happen?
Yeah, definitely. If you're thinking capacity from a IT computing perspective, it would be numbers, maybe.
Yeah, 100%. That's
Yeah.
what I want, 100%, Bonnie.
Yeah. Where as a clinician, Kevin would be thinking capacity, and we might be thinking around best practice. You know, you're taking somebody, and instead of the capacity of 10 minutes, you could do what you could do in 20 minutes, might actually treble the outcome. So, or when we're talking about capacity, that's why your module's so good. It's good to be, we might be talking slightly different language.
Yeah.
But for both of them to meet, it comes round to whatever you're trying to capture and improve an outcome, whether that's people through the door or better treatment. It is always about collaboration. And as we've said before, it's not like one solution fits all. It has to be a dynamic solution that goes round your individual patient or your individual clinician. Because say, in the old world, if you're, you know, you might in a tier of a career, you might be a physiotherapist, and then you might be you were called a senior 2 in the old day. You know, you might be a band 6, a band 7, and a band 8. And what comes from those different posts is different knowledge, experience, and sets of skills. So you might actually see less people the higher you go up, because those people are more complicated.
Yeah. Yeah.
So your 100% capacity would be different than someone, yeah.
Yeah.
Like, go on, you're thinking.
It's quite a difficult concept to sort of get my head around, and essentially it very much makes sense, because outcomes mean that, you know, if you have a successful outcome after a 20-minute session, that means that there's probably not going to be a repeat visit until maybe 6 months review or whatever further down the line. Then essentially in the long term, you are saving that time, but you're in order to save that time, it's taking you more time. So I think in the healthcare system, we are probably looking at the long term, and you know, this whole idea of reducing hospital stays, reducing bed nights, that kind of thing is how we're measuring the healthcare system. And you know, care packages of getting somebody in the home living independently is very much enabling that to happen. So your 20-minute session with them is nothing compared to the amount of staff required for a hospital stay and for a night in the bed there. The cost of that versus 20 minutes of your time is, there's no comparison there. So whenever you are like, suppose you do have to look at the problem more holistically than my job, the time that it takes me to get from one patient to the next. If we're looking at that granular level, it doesn't make sense at all, because you're pushing the problem to someone else, to some other team further down the line for yourself even. So I think that that's the whole idea, where you in practice you understand that, because you understand the different stakeholders and the process flow essentially with your patients. Whereas me, from a technology perspective, I'm looking at this one small silo and I'm thinking, okay, how do we make sure that Vonnie is going from 90% to 100% capacity, so that she can see that person for that extra 10 minutes in that day, so that we can fit more people in, so that they're not waiting as long. So I'm looking purely from that one silo, but essentially that could cause a problem and a sort of knock-on effect to other aspects of the healthcare system. So that's interesting.
Yeah, you're spot on, Kevin, definitely. And I think we have been measuring the wrong things about bed stays. Because if you're a 93-year-old gentleman who's had a fractured neck femur or a pubic rami, which is a wee bone in your pelvis, you don't need to stay in bed. It's better if you go home with a care package. But my point is, let's sit down together and measure the right things that improve healthcare, not take one isolated thing and say we need to reduce bed stays, because that actually might not be the right thing. Because the care package might not be set up, the environment for the person might not be right, and they'll be in again. And what's happened that I've seen over my lifespan of 20 odd years in the healthcare system is, if you look only at one little section, as you say, it will have a knock-on effect to another. And we've gone from prevention to crisis. So we're kind of firefighting in the health service at the minute, even before COVID, the last 10 years are firefighting. Whereas what you really want to do is say, like, stop, let's look, and to open up your question, let's look at, if we're looking at capacity, well, let's look at tech as a part of the solution. Let's look at what we're measuring. What systems are we measuring? Best practice? Are we measuring patient pathway? Are we bringing in measurement of person's health and well-being? It's just stopping and saying, what are we measuring and why are we measuring it? How's it actually going to affect the overall health care provision that we have in the UK? So for me, that's where I think your students have a wealth of knowledge. With their clinical knowledge and background, they'll have come up with ideas. Even in university, they'll have gone, Jesus, I wonder why we do that. Radiology, or beds do move up and down and side to side, but what if they turned around 360? Is that possible? In COVID, your practices will have changed.
So this whole idea of 100% capacity is kind of flawed from what I'm, what I'm talking to you about, because, there's other aspects that we're not considering and we're not measuring, but also this idea of everybody running at 100%, that's going to cause a severe problem down the line in terms of mental health of staff and, actually the joy you have in your own job and creating those solutions, enabling people to live well. And, that's pushing another problem on the healthcare system, where if people are off sick with mental health, we don't have the capacity then to be able to see the patient. So is it a false economy? So that measuring capacity idea is something that's very interesting.
Yeah, definitely. And it's what you want to measure and why. And there are loads of different ways of doing it. You could measure the tech, someone's knowledge. You could look at the systems. And with your current students, with their wealth of clinical knowledge, which is a complete asset, they will have thought of both noticed problems and thought of solutions in all those areas. Just to, I always think of improving the client or patient pathway as well as our systems in work, like efficiency of the service, effectiveness of practice, and our measurement of outcomes. Are we measuring what we do, both in terms of time and quality? Has that moved on? Has those tests moved on since 1940?
So in terms of like overall technology solutions within Dial, within your own practice in occupational therapy, you've been involved in a lot of different changes, with the introduction of technology, product design, innovation in general in the way that practice is being delivered. So there's a lot of different solutions that you've seen in your time and your experience. What do you think, in your opinion, then, are the emergent trends in healthcare for the next 10 years?
That is an interesting question, because if you talk to different people, they all might come up with, different ideas. But how I would see it, looking at the research going on out there in different fields, both here and internationally, and also looking at the trends that seem to be appearing, wearable technology.
Yeah.
So we're all sort of wearing it or having it around us, Alexas, your watches not only take your BP or your steps, they might measure what you're eating, your sleeping pattern. And then on top of that, they can make suggestions. You could have a wee alarm, time to get up, you've been sitting for 45 minutes, That's definitely going to continue. There's loads of goggles and eyeglasses out there that are registering a vast amount of information. There's biodynamics. I know that's one of my favorite words in talking to you in this interview, Kevin, but when it comes to biodynamics of everything, that's where you want a product that's flexible to each client. So I can see those really flying, and the technology behind them, the software is coming down in price. So we're going to be more likely to have them. Everything AV, AR, VR. So from your Oculus headsets, which are still in the kind of gaming world, but they're coming into health. They're coming into simulated learning, and we've loads more we could do on that. I don't know any simulated learning around radiography or physiotherapy, but I know there's quite a bit happening in nursing. Mm-hmm. So even from this remote way that we're living at the minute, that kind of VR, virtual reality, simulated learning is a winner. So we can see more happen there. Not both on the headset, but there's rooms, sensory rooms being set up. Lots of research that's happened with Ulster University and Dr. Suzanne Martin around brain injury, and you were taking someone with a brain injury and using their initiation of thought. So their initiation of thought. So that's like, sci-fi stuff.
Yeah.
Used to be, I'm thinking of moving my hand, whereas now we're doing loads more with amputees, where someone has that thought, they can move their automated finger. I mean, it's amazing stuff, and we need more of that. And that's where you need your clinicians to input from the ground up. So from homes, cars, sunglasses, like daily activities of daily living, everything. Yeah, those are the big trends around health and well-being and leisure.
Yeah. I think that there's definitely like there's a lot of different trends within healthcare technology, and the idea, you're saying, oh, this is sort of sci-fi stuff, this brain computer interaction stuff. Like whenever I was doing my PhD, 10 years ago in the Intelligent Systems Research Center, that's what we were working on. We were working on
Yeah.
these gaps, and we were working on the measuring the brainwaves and being able to understand it. And at that point, it was very much quarters of a screen and playing games up and down and very basic, but I know it's moved on, and it's not these big rubber caps you wear anymore.
Yeah.
They're a lot more sophisticated, and I think that's the thing where it's moving out. I know Queens do a lot of work in that area as well, where it's moving out of research centres into some clinical trials and being able to measure the success of this. And we might be talking in 10 years time and these are actually used in practice. It's getting the cost of that down, getting the scale up, but also, and it sort of ties in with your occupational therapy role, where essentially you're tying multiple solutions together. So this integration of technology is probably going to be one of the biggest trends. Where we talk about wearables. We have the wearable that captures some of the information, but also in your home, there's contextual conditions that can be captured as well. Whether you're out, whether you're driving, that kind of information on your phone, that can all be essentially data is what's important,
Yeah.
and everything's connected with data. And like that's the one I'm interested in, where I'm thinking, okay, we have data from this and we have data from that, and the individual hardware and the individual solutions doesn't interest me in the silos of the individual conditions, but in terms of pulling that together, the aggregation of loads of different tools and pulling all that data together and being able to make more inferences from that data. Like
Absolutely.
I think that that's going to be a huge enabler for assisted living. But it's going to be a huge enabler for people, living their life. And this whole idea of, we have the watch now that tracks your heart rate, the number of steps you take. It knows when you've been sleeping, and knows how restful your sleep has been, and it knows your pattern when you normally wake up. It knows your levels of activity at different times. So if your activity levels are lower, are you more likely to be stressed during that time? There's a lot of inference that can be taken from all that data, and when you couple it with other data, there's so many different solutions that you can put together in terms of the whole wellness idea. Like health and wellness was always a thing, but the wellness never got much of a look, and it was always very much health. And I think technology is moving more towards that wellness aspect of, we're going to stop firefighting here and treating the symptoms. We're going to start looking at enabling people to live well, and hopefully that will have a knock-on effect further down the line. So you're talking about, very interesting and diverse areas, and that's the best thing about the technology solutions, where the augmented and virtual reality in terms of training, but also people with dementia being able to reminisce using these. There's so much work that's going on in that area, and it's so life-changing for those that are involved in those studies. But families, when they're sitting and taking that walk down memory lane, where they maybe have videos that could be embedded into virtual reality or something like that, we don't have the tools available now, but they exist, and that's the frustrating part. Sometimes it takes a long time for technology to get to a level where it's actually going to be used in society, and that's the frustration.
Yeah. And also the challenge, and it can be exciting, because that's where your world, knowing it exists but hasn't yet landed, with us as clinicians. When we start talking and collaborating, that's where you're like, whoa, can we do a wee pilot study, and can we,
Yeah.
get the ball moving? No, it's exciting. It's exciting times, definitely.
I think that's collaboration is definitely the word there, where whenever we're talking about healthcare technology and digital healthcare in general, we need that collaboration between practice and computing, research and practice, and you know, the use of demonstration centres like DIAL, where you are that middleman, where essentially it's testing in a safe environment, getting feedback in a safe environment external to the researchers, so it's very independent. Like I love the idea, and it's great that, you know, yourself and Geraldine have worked so hard in setting that up. And I know at the minute with COVID, it's very limited how much demonstration you can do and have people in the centre and all that sort of stuff. But hopefully, you know, the future is going to be very bright for DIAL in terms of demonstrating that technology. And Fanny, I just want to thank you for taking the time to come and talk to the students. I just want to, if you have a final thought or a last word that you want to leave the students with, that would be great.
I would say value your clinical knowledge and experience.
Yeah.
And collaborate, find a good collaboration partner, and think of it being dynamic as possible, and then you can change the world.
That's strong words to end on. Thanks very much for that, Bonnie. Thanks for doing the interview, and I'm hoping the students will get an opportunity to meet you later in the course if you come back and have a look at their posters at the end. That would be brilliant.
Love to.
All right. Thanks
very much, Kevin. All the best, everybody.
Bye.
Bye-bye.